In this video, we're going to show how to do a skill evaluation for the adult healthcare provider level rescue breathing situation. Today we have Genevieve who has come in for the skill evaluation. She's my student for this. As a skill evaluator, I want to make sure that I have my skill practice sheets available in front of me. It helps me to stay on track, to stay on task for the skill. That way, if the student is getting out of sequence and I'm trying to watch the student, it helps me to stay focused and stay on track as well as a skill evaluator. Again, there's nothing worse than a skill evaluator and a student that are both confused, so we don't want that. That's what this tool is all for. The skill evaluation practice sheets help you in that manner. I have the adult mannequin ready to go with a face shield. And Genevieve, today we're going to do the adult rescue breathing for the healthcare provider. So as a skill evaluator, I'm going to prompt her through the skills. I'm not really trying to tell her every step to do necessarily. Now, if she needs help, I'm going to help her, and we're going to help her with that practice. And we may even practice through it once or twice before we actually do a full evaluation with her, depending on her comfortability with the skill. So let's go ahead and Genevieve, we're going to do the skill now. And again, don't worry, we're going to help you here. If you need help with, if we need to practice, we'll do that. But we'll see how you do. So we're going to give you a scenario. We'll say that you're working in a hospital one day, and you walk into a patient's room, and the patient is laying on the floor, not looking too good, kind of blue even. What are you going to do?
Okay, I'm going to go check them to see if they're okay.
So even before you get near that student, is there something you might want to think about first?
Right. I'm going to look to make sure there's nothing, wires, anything like that, out of the ordinary.
Excellent, excellent. You're asking yourself what might have happened here, checking the scene for safety. The scene is safe, and there you are. You're now next to the student.
Okay, so I'm gonna check. Sir, are you okay?
Okay, there's no response. Well, who do you want to, if you don't have a response at that point?
I'm going to call for a code, call 911, or
Excellent.
Get emergency help.
Good, and now what are we checking?
Pulse. Right?
Good. You're checking for the pulse. And remember also looking at the chest for chest rise and fall, any signs of breathing. And remember your pulse is going to be right on that side of the neck and the carotid artery. And so we're down just a little bit low there. You want to come up more towards this area right here to check that pulse.
Okay.
There you go. Good. And you do that for how long?
Just 10 seconds.
Right, no more than 10 seconds. I'm going to say you do feel a good, strong pulse, but this person's not breathing. What would you do?
Pulse, so the heart's beating. No breathing.
Right.
Okay, I'm going to do a rescue breath.
Okay, and how many of those are you going to do and how often?
I would just keep breathing for them, right? And then every 5 seconds? 5
seconds, that's right. So one breath every 5 seconds. Go for it. So good. You've opened the airway. You're pinching the nose. Good. And we're going to count to 5 in between each one.
4, 5.
Good. Now you notice that I had to help her a little bit. We had to kind of go over some of the different details of this skill. In this type of situation, what I would do is I would go ahead and have her try it one more time without me telling her what to do. Because we did take time, we practiced it, we told her the right things to do, and that's good, and that's encouraged. But again, because of that, I would go ahead and say, okay, Genevieve, I'm gonna go ahead and stop there. That was great. Let's go ahead and do it one more time where I just give you the prompting, and we'll see how you do this time. Okay. And so that's how I would do that skill evaluation. You wanna make sure that the student has a good understanding of the skill, is able to do the skill correctly without a lot of help, and that's the idea. So in that situation, once she's able to do that correctly, that would be the idea of how she passes the skill.